Hi, my name is Linda-Gail Bekker. I'm the director of the Desmond Tutu HIV Center and the executive director of the Desmond Tutu Health Foundation. World AIDS Day in 2022 has the theme of equalize, and this is an important concept because we do live in a very unequal world, particularly when it comes to healthcare provision. And recently there have been some pronouncements that we are near the end of AIDS. That narrative hides the fact that there are many inequalities around the world when it comes to HIV services and provision. We have a very exciting HIV prevention toolbox now. Part of that includes antiretroviral-based prevention, and that really means pre-exposure prophylaxis. So pre-exposure prophylaxis has been around for more than a decade. It is the concept where you take a pill a day to prevent HIV. And in that pill are 2 antiretroviral agents. So let me be clear, PrEP is for people who are not HIV positive, and it is to prevent the acquisition of HIV infection. So a pill a day can keep HIV away. Even more exciting now is the advent of less frequently dosed pre-exposure prophylaxis. And here we include the vaginal ring. This is a ring made out of an antiviral agent called dapivirine. It's inserted into the vagina by women who wish to use it on a monthly basis. And this protects women against HIV acquisition. Cabotegravir, long-acting, only needs to be administered once every 2 months, so 6 injections a year, and it is given as an intramuscular injection. This particular agent, because it is infrequently dosed, easy to take, has shown incredible reduction in acquisition of HIV in the order of 89% amongst young women and girls. So really phenomenal breakthrough for us in the prevention field. We are bringing PrEP to 25,000 young people, young women and girls, young MSM, and their partners in a single health district, and we are really devising it in a hub and spokes way, a variety of ways of bringing PrEP to individuals in that community. So we have mobiles, we have couriered services, we're able to access PrEP at school, access PrEP in various depots, in clubs, and it really is a lot of fun. So that's Fast PrEP, and we're very excited to be making these contributions to how we should do prevention in the future. So all of these concepts and these difficulties, challenges, hold back the progress we need in making sure that people around the world are able to access and utilize to the best possible means treatment and prevention. So we do have to overcome stigma, but it is a hard nut to crack. And the only way we can do this is if we are all absolutely informed about what HIV is and is not, and about the fact that people now can live normally, even though they have HIV on board, and they can protect themselves easily from HIV if they know about the prevention modalities and apply them to their lives. So that helps to erode stigma. And I think it really does mean, as part of equalization, that we make this information as available as possible to absolutely every single individual on the planet. Antiretroviral treatment has changed the face of the HIV epidemic, and we've learned more and more about treatment as it's gone along. Now, one of the wonderful breakthroughs that we know is that if people who are living with HIV take their antiretrovirals as prescribed, their virus will go down, and we talk about virus being suppressed in the blood levels. And once those drug levels, those HIV levels are completely undetectable, therefore fully suppressed, the being kept down by taking the antiretrovirals every day, that virus can no longer be transmitted. So undetectable equals untransmittable. And basically it means if I'm taking my medication, I am no longer contagious to other people. And that's really incredibly liberating. So we really want to get the U equals U message out to as many people as well, because one, it means go and get tested, make sure you know your status, because you too could benefit from this. Number two, if you know you live with HIV, take your antiretrovirals every day, because you can become undetectable and untransmittable. We really have the tools today to eliminate vertical transmission of HIV. Transmission of HIV from pregnant or breastfeeding women to their children. And we know exactly how we should do this. It's absolutely imperative that those young women, those women of childbearing potential are found, are able to access treatment and take treatment in a way that keeps them undetectable. We then know that that risk of HIV transmission is completely eliminated. And this is exactly what we need to do to stop pediatric HIV in children. Every day that a child is born and acquires HIV, they face a lifetime of antiretroviral treatment taking. So it absolutely is key and critical that we find the way to eliminate vertical transmission of HIV. I think the HIV response can actually teach other fields of healthcare a great deal of lessons. One thing I think we have come to recognize is the best way to reach individuals and keep them in care is to provide patient-centered care. So this means that we really differentiate our services. We think about the individual. We put the individual at the center of what we are trying to achieve. And we say, how do we make sure that these services are tailored to the person's need? They're integrated. In other words, we co-locate other aspects of their care and we differentiate them to their needs. So if, as an example, we're trying to reach adolescents, we should structure our health services to open once school is closed, right? And make sure that adolescents can come to youth adolescent-friendly services at a time when they're out of school. Indeed, to reach men, we may need to have our services even later in the day when work is finished. We may have to provide for young women a service where they also have childcare facilities. We may need to make the services available to people where they are in their community so they don't have to face transport costs. These are some of the things we can do to say, how do we differentiate services to ensure that people can come? And it really addresses the who, the what, the how, and the where. Who will give those services? Because we know sometimes peers and lay healthcare workers are much better at providing a particular service than a healthcare provider who's busy and may not have the time or the resources. We have to say where. For example, we're now saying we have to move out of facilities and into communities. The what? How do we wrap services around so that together with PrEP, maybe we supply also contraception and STI as screening and treatment. These are some of the things we need to do to really ensure that individuals not only feel they can, but we make it easy for them to come to our services or find our services and stick with those services to ensure that treatment and prevention is as effective and as impactful as possible. Two of the aspects that we have still got to overcome is the fact that we do not have a preventive vaccine for HIV and we don't yet have a cure that is scalable for HIV. So on the vaccine side, it's extraordinary to think that it took a short 9 months to find a SARS-CoV-2 COVID-19 vaccine, and yet we've been battling for 40 years to find a vaccine for HIV. And there are many reasons for this, not least the fact that it is a different virus and it's quite a complicated virus compared to COVID-19. The Desmond Tutu HIV Center started way back, really in the days before treatment, and those were dark and grim days when people were dying and there was very little we could do except palliate. So a lot of our work in the very early stages was how could we help people die with dignity and how could we relieve their suffering. With the advent of antiretrovirals in the mid-90s, we were very excited to get on board. The drugs were way too expensive. They were not available in the Southern Hemisphere. And we recognized that if we could bring them here in the form of clinical trials, we would be able to at least offer them to some people. So that's how we started. It really got us going as clinical researchers. And then we became activists, right? We really pushed hard to see how we could bring the drugs, very much an equalize message all the way back in the late 90s. We also advocated, because remember we moved then into the denialist phase of the South African epidemic, where sadly political will went away. We didn't have leadership in terms of good treatment, and in fact we had the exact opposite. We had an administration that denied the origin of HIV as a cause of AIDS, and that really required us to get into the trenches in a new way. We became activists. We held hands with Treatment Action Campaign and other colleagues who made incredible inroads. From treatment, we recognized that we needed to move into communities, and so we started our work in actual communities where the burden was highest. From treatment, we've moved into prevention, from prevention into more broadly global health. And now our mission is really simply to ensure that we can bring the best possible health care to those who need it most, and to do our work in communities where the needs are greatest. And I am so privileged to be part of a great team of individuals who are 100% committed to that mission. We are inspired by our late patron and Mama Leah, who led with love and compassion. And that remains the core of our value, that God is a God who believes in equality, and has influenced our thinking, our progress, and ensured that we keep his values, Desmond Tutu, the late Desmond Tutu's values, at the very center of everything we do. What keeps me inspired is the notion that we will ultimately bring this epidemic under control, and that has to be the goal that we reach out for. It's the stretch goal. There are mile markers before we get there. We've got the 2030 goals that UNAIDS has set for us: 95, 95, 95. This means 95% of all the people in the world are tested, of which 95% are on treatment, and 95% of those individuals are undetectable. I would say we really want to stretch for 100%, because we don't want to leave anybody behind. And that really is another goal that we look to see how we can innovate about ensuring that indeed nobody is left behind. And then I really do see a world where prevention is a normal and very accessible concept for everyone. That people know exactly where they can go. They are empowered to bring and use prevention for themselves and for the people they love and the people in their families and the people in their communities. I think that's really important. And then ultimately, we take the lessons we've learned from HIV to apply them into a concept where we really do embrace global health. We say, how do we bring better health care to all people in every part of the world? We all have a role to play here in a country like South Africa. We have the highest burden of HIV of any country in the world. However, we also have an incredible Ubuntu spirit. We truly embrace community, and the best thing we could do for the HIV response, regardless of our backgrounds, is to recognize that we all have a responsibility to know everything we can about HIV. We also need to know how we can help people in our communities to understand it better, and we can reduce stigma through awareness. We can make sure that individuals who live with HIV are celebrated and loved and assisted in their task to ensure that they stay in care and on treatment. And we can guide other people, young people in particular, as to how they can be more aware of HIV, know their status, and access prevention. These are the things we can be doing as individuals regardless of who we are. And perhaps most of all, we can practice that spirit of Ubuntu, which is, I am because you are, and my humanity is through your humanity. We recognize that we each have goodness, and we can each bring out the best in each other. That, I think, would also do so much to help us, get beyond the HIV epidemic and other health challenges that we may face.